Hello, everyone, and welcome to this episode of Wings Podcast. This is your host, Milind Agnihotri. On today's show, we will meet Dr. Siddhant Lalwani. A young pediatrician by profession, he is currently pursuing his international fellowship in pediatric pulmonology. Siddhant says, and I quote, "My goal is to improve pediatric healthcare services in India, try to standardize it, and make it at par with the Western world." Unquote. Siddharth also loves cooking, traveling, and is a certified scuba diver. Welcome, Siddhant, to this episode of Wings Podcast.
Thank you so much. Thank you so much. It's been a pleasure, and I really am looking forward to this podcast today. So thank you so much for having me on this podcast.
No, same here, Siddhant. Uh, uh, I've been knowing you for many years now as a friend of my son Rahul. Both of you have kind of studied together. Of course, you guys pursued different paths. You took medicine, and Rahul went on to do his computer science engineering. But yes, I've been knowing you, since your early college days, and it is so nice and proud to know that you have achieved what you always wanted to achieve, and you are pursuing a very different area of medicine, which I would love to understand more from you about pediatric pulmonology. So why don't we begin this conversation by you helping us know what is pulmonology as a science, and what is pediatric pulmonology, and your journey up till this stage.
Yeah, sure. So for all the listeners, pediatrics is basically a medical term for a doctor who treats children. So essentially, we treat children right after birth till 18 years of age. I currently am pursuing my pediatric pulmonology fellowship. Pediatric pulmonology means I'm basically treating all illnesses, respiratory illnesses in children. So, be it lungs, be it the airways, be it the oral cavity, the nasal cavity. So, it's everything from the nose to the lungs, till the lungs rather, is what we are treating. And I specialize in pediatric pulmonology, which is all these ailments in children till the age of 18 years. So I basically started my journey in 2012. I joined,
Mhm.
as you rightly said, I was with Rahul in class 11th and 12th.
Yes.
And then I started my journey in 2012. I joined my MBBS from Bharati Vidyapeeth Medical College, Pune.
Mhm.
Uh, those were some amazing years. We had some great fun. Though I always wanted to become a doctor since my early childhood days, since my parents are doctors, and I hated maths. So bio was my only option, and the only profession I was looking forward to was medicine.
Yes.
And so I think all many of the people think that MBBS per se is a very serious course, but I must say that trust me, it's one of the most amazing and memorable uh, journey of my life. It has been the most memorable journey of my life because not only does it involve a lot of studies that take place, but also innumerable memories from many of my friends I've had. And so in MBBS, usually I've had friends from all across India,
Mhm.
some from Delhi, some from Bangalore, some from South India, some from
Mhm.
up north, some from the east.
Okay.
So, and even some international students as well.
Oh,
So, I
okay.
mean, getting to know them, yeah, so getting to know them and their cultures, it has been a culmination of some amazing memories. And
Mhm.
we studied together. We used to go out for dinners together.
Mhm.
We have all had our ups and downs, and we have shared all those feelings together. So, I mean, there have been some brilliant, amazing 5.5 years, including the internship. And in 2017 and 2018, I started my journey for my MD pediatrics degree.
Mhm.
And I again landed up passing out from Bharati Vidyapeeth Medical College, Pune, which has an amazing pediatrics department. And I have recently completed my pediatrics about 6 months back.
Mhm.
And what further is something what I wanted to add to my accolades is I actually wanted to venture into a super specialty that is yet not explored in my hometown Pune,
Mhm.
and then pulmonology struck me because there I mean there aren't many uh, pulmonologist practicing in Pune. So, and definitely I can add a lot of specialized pulmonology services in the pediatric age group in Pune. So I thought I should take up the fellowship, and yeah, so here I am pursuing my fellowship, and it's been great. It's really been amazing so far.
No, that is so fascinating. But before we get into what you're really doing or wanting to do, I know a little very, what shall I say, a common man question here. If you allow me to ask you, is
Sure.
5.5 years of MBBS, of course, is a very, very tough journey. You try to make it sound simple, but that's very kind of kind and humble of you. But at that stage, what I believe is many doctors are at the stage of choosing a specialization, and you of course chose pediatrics. But what kind of choices go through the minds of an MBBS doctor when he or she is wanting to choose a particular specialty, in general, and how did you end up making a choice for pediatrics? There could be so many, I believe, options are there. But so how does this process work of choosing your specialization in MD?
So yeah, that's an interesting question. First of all, talking from my perspective, I chose pediatrics because my father is a pediatrician, my mother is a gynecologist.
Okay.
So I've related myself to whatever my father has been practicing for all these years, and children always fascinated me.
Mm-hmm.
So definitely, pediatrics was something I wanted to venture into.
Mm-hmm.
And talking about choosing a particular super specialty branch during your MBBS days, it is quite tough.
Mm-hmm.
So usually in those 5.5 years of MBBS, first 2-3 years are you land up only studying and reading, but it's
Mm-hmm.
actually from your third year onwards when you get you start getting exposure to patients in general in the hospital wards,
Mm-hmm.
and maybe by the end of final year you can have an idea of what you want to do, since you've been exposed to all the specialties of medicine, be
Mm-hmm.
it surgical or medical. But and you obviously have to go through a rigorous process of the NEET examinations
Correct.
after you are done with your internship.
Correct.
So I think some of them, I think around 30 to 40% of them, that is a small chunk, make up their minds for a particular branch that they want to choose.
Mm-hmm.
And the remaining 60, 70 odd percent land up deciding after giving the NEET examinations.
Oh,
Because
okay.
it also depends on your score. Yeah, because it also depends on your score in NEET examinations, how well you're fared in those exams, that
Correct.
actually decide which field you want to choose.
Mm-hmm.
So for me, it wasn't a very tough decision per se,
Mm-hmm.
but for some of them out there, it might be quite a difficult decision, because if you're liking majority of the subjects, it becomes quite tough to boil down to one of them. But it's a difficult process for some of them, definitely. But if you have your ideas and goals clear since day one, I mean, sky's the limit.
No, undoubtedly, undoubtedly. I mean, but this branch of pulmonology, and whatever little I understood from you at the beginning of the conversation, it has to do with respiratory ailment. Now,
Yes.
you simplified it by saying that everything that happens from the nose to the lungs and any disorder in that space comes under this area called pulmonology. But is pediatric pulmonology, which is this respiratory ailment in children, is it really common? I mean, I'm not aware of it. How common is this?
Yes. So it's quite common actually. So
Oh,
there
really?
are adult pulmonologists as well.
Okay,
So
of
I'll give
course.
you a common example.
Mm-hmm.
Suppose a child falls sick, in the sense a child has cough, fever, and some runny nose.
Mm-hmm.
So again, runny nose is again an ailment that general pediatricians also do treat.
Correct.
Pneumonia. So children having pneumonias, again, the lungs are, I mean, they're getting infected. So
Mm-hmm.
again, a pediatrician lands up treating them as well. Asthma. So pediatric asthma is very common.
Oh, really?
And again, yes, very, very common. And it
Oh,
falls into our sector as well.
okay.
Then we have a terminology called as obstructive sleep apneas. So it's quite evident in India as well. Many of the children not only adults, also suffer from obstructive sleep apnea. So it's basically during their sleep at night, they land up, the breathing pattern isn't normal,
Mm-hmm.
and they have difficulty in breathing during sleep at night, which is also a very common ailment that is seen in children. So
Okay.
very commonly do we see pneumonias, asthma, a child having a chronic cough going on or lingering for a long time. Then
Mm.
suppose children, many children come with peanuts stuck down their nose,
Oh,
and yeah, foreign bodies. So we
okay.
have a lot of children who come with peanuts and other forms of nut, that while maybe eating they choke on it, and it
Uh-huh.
lands up going into the respiratory passage. And yeah, here comes your pediatric pulmonologist with a bronchoscope to take it out.
Mm-hmm.
So very common. We remove foreign bodies about 4 to 5 in a month, definitely.
Any,
So pediatric pulmonology.
yeah, any experience that you recall, offhand, where you were really challenged and pushed and, across all these areas of pediatric ailments in pulmonology?
Yeah, so off late, yeah, there was this 13-year-old girl who had come to my OPD with just complaints of fever since 1 month, nothing else.
Mm-hmm.
Uh, all she had was fever,
Mm-hmm.
and after a lot of blood tests and other forms of tests, we couldn't come to a diagnosis. And
Mm-hmm.
then we landed up doing a chest X-ray for her.
Mm-hmm.
On the chest X-ray, we saw a few patches in the lung.
Mm-hmm.
And she actually didn't complain of any cough, no difficulty in breathing, no cough.
Mm-hmm.
And eventually, so we got a CT chest, the CT scan of the chest done.
Mm-hmm.
And those showed the CT scan showed a lot of cavitating lesions or cavity-like lesions in the lungs.
Mm-hmm.
So we had the susceptibility of pulmonary tuberculosis.
Okay.
So in such cases, what we do is we usually do test the sputum that comes out from the chest,
Correct.
and we subject it for a lot of tests.
Mm-hmm.
But she could not induce a adequate sputum, so we decided, let's do a bronchoscopy.
Mm-hmm.
That is, we go in the child's trachea and the airways. We'll give a good wash with some water, and we'll aspirate that out, and that could be subjected to further tests.
Mm-hmm.
So actually, that child ended up becoming quite bad during the procedure, and the oxygen saturations dipped, and we had to intubate her and put her on a ventilator. So
Mm-hmm.
she was quite critical for about 24 to 48 hours. So that was
Mm.
a very challenging moment for me and my colleagues, because we had quite a tough time managing her. So yeah, that was my recent challenge a few days back, and it definitely shook all of us. And we were happy that she eventually was fine, stable, and we discharged her 2 days back.
Good, good.
So, and we did get a diagnosis of pulmonary tuberculosis, and we have started our own treatment as well.
Yeah, yeah. And I'm sure these must be very scary on the edge moments, because we've only, at least I have only experienced medicine as a science. I don't have any doctors in my family as such, but yeah, for me, the edge of the seat experience of medicine comes from watching TV shows like Doctor House MD, or some of those stuff, right? Grey's Anatomy and some of the stuff that you get to see thanks to OTT platforms. But I don't know, in your education, are you as doctors taught about how to, uh, stand firm in moments of such crisis? Is there a professional training, or you guys have to just learn it on the job, go through crisis after crisis, and somehow you kind of get that skill? How does that play out?
Yes, so actually now off late there is a training course offered during our MBBS days that helps you deal with such situations.
Mm-hmm.
In terms of crisis, how to counsel the relatives becomes a very important factor,
Mm-hmm.
because the child was steady and stable when the child was brought into the procedure. So definitely during when I passed out my MBBS, there wasn't such a formal teaching
Mm-hmm.
regarding communication with the relatives, or tackling with the stress of the situation. So
Mm-hmm.
we have learned with experience. But off late, yeah, there is a section in which they teach you how to cope up with stress during procedures, how to break out bad news,
Mm-hmm.
how to communicate with the parents well, or the relatives well. And I think that is very important because that reduces a lot of confusion.
Yes.
And definitely a lot of violence episodes against doctors as well can be solved if there is good communication with the relatives and parents, is what I firmly believe in. And a doctor is always straightforward and tries to express himself or herself to the parents, but that may not be the case in every circumstance. Every circumstance is different.
Correct.
So I think a proper communication is a key in these situations. And if you communicate well with the parents, I think 50-60% of the issues and stressors come down.
And also, Siddhant, thanks to internet and just about every information around most ailments, simple to extremely complex, information is out there. And, so is this, patient or the patient's relatives knowing a fair bit of, let's say, bookish knowledge from internet about any ailment? For you as doctor, is it a boon or a curse?
So, Google has created a lot of confusion.
Okay.
So we definitely do get patients in our OPDs, saying my child has these complaints, and I think my child has XYZ disorder. So obviously that parent has gone to Google, dug in deep in Google and searched, but that is not always the case. I think we have learned the process, the science, the physiology behind it, the kind of medications we give, and we have experienced all that. So I think it's completely wrong to depend on Google. I'll give you an example.
Yep.
So coughing out blood in your vomit can be because of multiple things. It could be because some local trauma to your oral cavity, or it could be because of, say, cancer in worst come circumstances.
Correct.
So the parents go through all of those differential diagnoses. And they boil down and they are really panicking. They're completely panicked out because they feel, what if mere bachche ko cancer hai?
Correct.
So what we tell them is we have learned the process. We are experienced enough, and it causes a lot of problem in our day-to-day lives, especially with tech parents who Google the complete all the symptoms of the child and come to us.
Correct.
So I would say it's a curse to us. But at the same time, Google has also helped us in certain situations. The well-educated parents who are quite understanding, I mean, they go through Google and it helps us in some scenarios as well. So
Correct.
it's more of a curse than a boon, I would say, of what I have experienced in the past few years.
Yes.
But other doctors may have a different opinion.
Of course. But Siddhant, I mean, this is sounding so fascinating and interesting. But for Siddhant Lalwani as a person, not as a doctor, a doctor is one of the most important roles that you are probably playing in your life. But is that the only thing, or is there some other life that Siddhant also enjoys living other than being a doctor?
Oh yes, I actually have many hobbies. I cook. I love cooking actually.
Okay.
So if not a doctor, I would have aimed to become a chef.
Oh really?
So,
Why?
Yes, because some people cook because they have to cook. I cook for de-stressing myself. So usually when I'm stressed out, I'll end up cooking a small dish and feeding my parents. So off late, I just got married about 1.5-2 months back.
Yes.
Even with my wife, yes. So on Sunday evenings it's my time, and I sit down and I cook for my family, including my wife and my parents. So it gives me immense satisfaction and relief when I cook. So I really love cooking, and I've been watching MasterChef shows, MasterChef Australia, all throughout my childhood.
Yeah.
And it's something that I really, really enjoy doing. And also I love traveling. Because of COVID, I have stopped traveling, but
yes,
I do travel a lot. Yeah.
But tell me, Siddhant, just a little, I don't know, hypothetical question here. Let's say the coming Sunday evening, let's say your parents and your wife say that let's have some family time together, and you decide to cook a meal for them. What would your menu look like? What?
Yes. So family time is something that is very important to me, because no matter how busy you are from Monday morning to till Saturday evening, but Sunday should be dedicated to family, is what I firmly believe.
Mm-hmm.
So a typical Sunday evening is what a menu that I would keep or we cook for my parents, my wife, is maybe some good Italian pasta.
Mm-hmm.
My wife really loves Alfredo or the white sauce pasta. That
Wow.
is something I would cook. And my mom really loves Indian sweets.
Okay.
So if I could try, yeah, even my wife loves Indian sweets. So maybe some pasta with garlic bread and gulab jamun, if possible, if I'm able to make it in that time, is something I would, try making for my parents and my wife.
This is so mouth-watering, Siddhant. If and when this event happens, don't forget me and Asha. Okay, give us a call. We would love to hop over
Definitely, definitely.
and enjoy the food. This wonderful meal that you would making. One more thing I know of you, Siddhant, is uh, you are a confluence of two very distinct, different, and extremely rich Indian culture. Your father, I know, is comes from the Marwari tradition, and your mother is from Kerala. Uh, so,
Yes.
so how has that influenced you and your growing up? And I know you talked about
Yeah.
you getting married about a month and a half back, and I know your wife is a North Indian Punjabi. So that's a very interesting confluence that you are at. You know.
Yes, yes, yes. So definitely, both the set of cultures have had a great influence on me.
Uh-huh.
So my father being a Marwadi and my mom being a Keralite
Yes.
has helped me grow as a person, definitely. So actually, the first language I learned was English. I started
Okay.
off with English, then Hindi followed, and then Marathi, and then Marwadi and the other languages.
Okay.
So I know about 5 languages. So first thing, my language skills have improved for sure.
Mm-hmm.
Second of all, both since the traditions and customs from both sides are very different. They're very,
Yes.
very different.
Yes.
So yeah, so South Indians are usually quite mellowed down, whereas Marwadis are always, proactive. They
Yes.
want to get things done fast,
Yes.
and it's quite a different mixture of cultures that I have experienced per se. Even in my wedding, we had one event which was a Marwadi themed event and one event which was a Mallu themed event, and eventually the wedding which was a Punjabi wedding.
अरे
So it
क्या
was
बात है क्या
even
बात है क्या बात है
so actually, in terms of thinking also, so what
Uh-huh.
I think, my parents had a love marriage.
Yes.
So did I.
Oh,
It helps your thought process. Yeah, yeah, yeah. So my parents have also had a love marriage. They were together for about 7-8 years before they decided to get married.
Mm-hmm.
And I think what becomes important is to understand each other, to understand each other's background, family traditions, moral values,
Mm-hmm.
and to go with it and let the other person be, and give them some space, give them their own space, is what I
Mm.
think is the secret recipe to a love marriage that has been culminated from two different traditions. So
So
I think you should let the other person be in terms when they need their own time.
no, so beautifully said, Siddharth, because that is one part of one's being where one tends to focus so much on our work profession. Of course, work does define much of who we are because 12, 14, 15 hours of the day we are doing our professional job, whether you as a doctor or or anybody else doing their profession. But there is so much to life more than work, right? I mean, you also are enjoying a scuba diving. That's something
Yes.
so interesting. So how did that happen to you?
Yes. So actually, the crazy traveler that I am, I really love traveling.
Mm-hmm.
So about 4 5 years back, me and my friends from undergraduation, we
Mm-hmm.
decided we'll go on a trip together,
Mm-hmm.
a backpacking trip together. So we
Okay.
decided, why not club it with something interesting that we have not tried before.
Mm-hmm.
So then I had the idea of scuba. I've always seen people do scuba. So
Mm-hmm.
skydiving or scuba was our option. Since we had a backpacking trip and skydiving is expensive,
Correct.
scuba is relatively cheaper than skydiving. So
Correct.
my friend knew a common friend who had a diving center in Andaman.
Okay.
So we worked out the logistics. We stayed in a hut that was barely some 700 to 800 rupees a day. We had decided we'll dedicate all our resources to the course and we'll spend ample amount of time there. So yeah, I did my basic scuba training. It's by the Scuba International, or SSI, in Andaman, Havelock Island to be precise. So it was a 7-day training where we had about 2 to 3 dives per day for 5 days. So after 5-6 days of diving, we were handed over. We had a small exam, and we were handed over our certificates. And ever since, I've done about 10 odd dives in the last 5 years. Obviously, my profession hasn't given me much time to explore, and COVID being lingering around for the last 2 years. But that is something definitely I would like to do more and more in coming years. And it's again amazing. I mean, the experience when you're underwater with the creatures in the ocean, and it's so calm, it's so serene, and you are yourself, you're at peace that time, is what I feel.
No doubt. I mean, I can tell you, of course, I haven't done scuba diving. I don't know whether I'll get to do that, because going to that depths with the oxygen cylinder on my back, I don't know whether I'll probably do that. But yes, I love snorkeling. And the underwater ocean is that you see is such a different world. But if I were to ask you that there are these 3 passions of yours: cooking, traveling, and undersea scuba diving. If there are any lessons from these that you come to your aid as a doctor, what could they be? I'm just curious to know if there are anything that you can draw from the world of cooking or traveling or scuba diving into the work that you do in as a pediatrics surgeon.
So per se, all my hobbies, one thing I firmly believe in is trying to, I mean, if you love something, go for it. I mean, don't have 2 thoughts about it. The more you think, the more you're pulling yourself down. And suppose I decide tomorrow I want to do skydiving, I will come up with a plan, no matter how busy I am. So in the same sense, in medical profession, I think once you are in the process of your graduation, or you have graduated, never think twice is something I feel. If you think you should go with it, you should 100% give all of it and go ahead, and not wait, because the moment you wait, you'll ask 100 people, 100 people will give you 100 opinions, and that will pull you down. So if you feel it's right for you, you should just go ahead. And that has also helped me in my pediatric practice. So, I mean, if I think a particular diagnosis is what it is, I should go with it and not think much, because, every patient wants a confident doctor. Correct. They want someone who is confident in their knowledge, who is confident in speaking. And the moment, you should just go for it, is something I have learned. And I keep experimenting, even with cooking. It's not that always all my dishes come right, but eventually there'll be this one dish that I've tried and it turns out to be amazing. So you can have miracles coming if you push yourself harder. And I think sky's the limit if you keep pushing yourself every day.
Sure, absolutely. I mean, but you've committed yourself to a goal of improving pediatric healthcare services in India, and trying to standardize it and making it at par. So what can you just kind of elaborate this goal or the vision or the dream you have for yourself?
Yes. First of all, India has very few doctors in comparison to the population we have.
Correct.
Amongst the doctors stand pediatricians, which are again minuscule to the number of children we have. So, I mean, in a city like Pune or maybe Mumbai or the metro cities, you may not be falling short of pediatricians. Correct. But trust me, in the rural areas all over India, there is definitely a need for many more pediatricians, number one.
Correct.
Second is affordable health services and standardized health services. So many of the services that are provided are maybe affordable, but they're not standardized enough. And we'll end up losing a lot of children because of non-standardization of practices.
Can you take any example?
And one more thing,
can you take an example to help us understand what does the lack of standardization is doing?
Yeah, so I'll give you an example. Suppose you have a child who is sick and sitting in a rural part of Maharashtra, and he's in a village. He wants to see a pediatrician. They only have a general practitioner in the village who says, your child is not getting better. You need to meet a pediatrician. So they travel all the way to say a metropolitan city or a nearest city that they can find where you have a pediatrician.
Correct.
And already a lot of time has elapsed, and that pediatrician then says, no, you should refer the child to a super specialist, because say the child is having pneumonia, and the pediatrician says you should meet a pulmonary therapist or pulmonary pediatrician. And they waste a lot of time, and the patient goes from the village to one pediatrician, then to the super specialist. So one is standardization. The referral should be very crisp. And second of all, the more number of pediatricians are there, uh, the services will be better, and so it's not all pediatricians are pulmonologists,
Correct.
so so they should know in short is how sick is the child. Can the child be sent home on medications, or does the child need urgent admission and further treatment? And we have many homeopathy, Ayurveda doctors also practicing pediatric. I mean, they're treating pediatrics as well, or children as well. And at times, I think that could be slightly different when a child is sick. So when a child is actually sick, requires admission in a hospital, he or she will land up losing a lot of time. And that is where I think standardization of services will come into play. And one more thing is affordable healthcare services. That is something I've talked about a lot in the past few years. We are sitting in a city like Pune, where all the health services are available, but it comes at a cost.
Correct.
So not all parents of these children might have money to get their children treated. So many of the times we do have children coming in who are quite sick, and the parents don't have a penny. So one more thing that my unit is doing is we are doing a lot of crowdfunding of late.
Oh.
So maybe I won't take So I won't take names of
course,
these crowdfunding people, but so we are doing a lot of crowdfunding to help such children in need who definitely will benefit from the kind of treatment we are providing.
Correct.
And we can see their smiling faces on the way back home when they are discharged from the hospital. So one is quality treatment, which is standardized, and second is good treatment at a reasonable rate or a reasonable charge is something I'm opting to do. And why I selected pediatric pulmonology is because it is a niche branch though, but there is need of pediatric pulmonologists in India. There are very few pediatric pulmonologists in India. And so see, every case is a complicated case. Not all pneumonias can just be given some antibiotics and they get treated. So some complicated cases, you need specialized doctors, is what I feel. And so India is actually quite behind, is almost 10 to 15 years behind healthcare services as compared to the West.
Yes.
So two things that are responsible for this. One is population.
Of course.
And second is standardization. So I think population is beyond our control.
Correct.
So what we could do is maybe standardized practices. More and more doctors should pass out, and we should try and recruit more pediatricians. And there has to be a pediatrician maybe at every taluka place or every major healthcare referral center who can at least help such children who are deprived of essential healthcare services.
No, this is sounding so fascinating, because you are actually, if I'm hearing you correct, you are actually talking about bringing in management science to medicine and healthcare. Because you talked about standardization, you talked about affordability, you talked about access, you talked about systems and processes to be put in place so that information is available, and thanks to mobile technology and apps, I'm sure so many rich possibilities are there. So this seems to be a very interesting possibility, Siddhant, you're pointing out, where management thinking and science can also contribute to improving healthcare services, which seems to be your vision, and it is so beautiful and so rich. And I'm sure this gap that you talked about in pediatric practices in India, which is probably 10-15 years compared to the West, which is fine. But I think with young doctors like you, who are so clear about their vision, who are so clear about their goals, with such a passion, where you also bring your heart to the work is so fascinating to hear this. So, Siddhant, I mean, if I were to ask you at this stage of a conversation, which is kind of I have to kind of bring it to the closure given the time that we have, is if you were to say that if these are the 2 or 3 things I see myself doing, let's say 5 years from now, that will make me proud. I'll pat myself on my
Yes. So
back. What would they be?
yes. So first thing is no child in the city of Pune. So I can start at the local level to start off with. So maybe
Correct.
5 years down the line, no child in the city of Pune should be deprived of healthcare services because of lack of monetary aspects. So because they don't have money. One.
Correct.
Second, no child should get delayed treatment. So every child
Mm,
should be diagnosed as early as possible, should be
mm,
referred to the right doctor as early as possible, and we
mm,
don't lose a lot of critical time. Is second. And third is maybe try. I mean, even continuing the good health of children is another major aspect.
mhm,
So I think, and one more thing is nutrition. Off late, we are trying to. One more thing I would like to add here is nutrition in pediatrics. Off late, because of COVID and the Western literature coming into play in India, a lot of
mm.
children are turning out to be obese. So
Correct.
that is something we should address as well. And
Mm,
so training them right from health aspect, as well as so they can have anxiety, depression, and all these issues should also be taken care of and tackled well. So
mm.
definitely I would like to improve all of those aspects as well.
No, looks like Siddhant, a lot of work is cut out for you, and I am sure with very focused and committed steps that you will take in these direction, I'm sure you'll achieve all these goals and probably even more. There's so much of life that is in front of you. You are just a young doctor who just got married, and with such amazing vision that you have for yourself and for the profession that you have chosen. So all I can say is thank you so much for sharing about you on this podcast. And if I were to ask you, how has this conversation been with for you, and what is this experience leaving you with?
Yeah, so it's been a great experience per se,
Mhm.
and I love talking to you. I've always loved talking to you and your family. But
Thank you.
on this platform, trying to express what my vision is
Yes.
with you and with all the listeners out there,
Yes.
definitely it makes me feel satisfied, because it's one, I'm delivering the message on a public platform.
Correct.
And I just want to also highlight the fact that work will always be there.
Mhm.
Also give time to your family, because family is family is something, and someone, they'll be there in your ups and downs as well.
Correct.
So spend ample time with your family. It's never too late.
Awesome, awesome. Siddhant, all I can say at this stage is, let's have that little Sunday evening meal that you will make. And from my side, I and Asha will bring in a chocolate mousse. I know you love that. So we will
Definitely.
make chocolate mousse for you
Yes.
and your family. So look forward to that wonderful evening. And thank you so much once again. God bless you. And may you achieve all your dreams that you have on the way. Have a good life
Thank
and
you so much.
take care of yourself. Bye bye.
Thank you so much. Thank you so much. Bye bye.
Thank you for your time today, my dear listeners. This is your host, Milind Agnihotri, signing off. Goodbye, take care, and stay safe. This podcast is for general information purposes only and should not be considered as a piece of any professional advice. Views and opinions expressed in this podcast are those of its guest. Creators of this podcast expressly disclaim any and all liability or responsibility for any direct or indirect, consequential, or other damages arising out of any individual's use of this podcast. For feedback and suggestions, please write to wingsindia75 at gmail.com. Thank you.